Dr. Twyman. He is the brother of Jeff Twyman from St. Charles City, if anybody knows Jeff. He's here to talk about it. It says cardiology or cardiac review or whatever on the training thing. That's just because there's really no other way to term it for logging the training purposes. So this is more just about like your heart health and not really about patients and things like that. Although if you had a few road patient questions, I'm sure he could probably handle those. He's very capable. So he's going to talk about some stuff. I don't know if you've talked to the other shifts and heard some of the crazy crap that came out of A shift. Sorry, whenever he talked to them. So like when he tells you not to wear sunscreen, it doesn't mean that like go out and fry. It means wear a hat, wear a shirt, things like that. Those are the things that A shift tend to, like, they left off the stories. So there's more in typical firefighter fashion. There's probably more to the stories you may have heard from some of the other shifts. But he's got some good stuff, so I'll turn it over to Dr. Twyman.
Wow, thank you. So yeah, I'm Dr. Michael Twyman. I'm a heart attack prevention expert, and I'm also a biohacker. Biohacking is basically just optimizing your health. We'll talk some of the details about biohacking through the presentation, but kind of the outline is, tell you a little bit about myself, what makes me different than the general cardiologist, some testing that you can do that tells you what your risk of a heart attack truly is, and then some things you can do other than pills and procedures to reduce your risk of having a heart attack or stroke. So just a little bit about myself. Yes, Jeff is my brother. He's out in St. Charles City. My dad was a firefighter as well at Ladue, Collinsville, and ended up at JPL in Pasadena, basically the NASA fire chief out there before retiring. So I know what the fire service is like. I grew up in it, see all the stuff that you guys are exposed to, and did all my medical training down at St. Louis University. Had the U.S. Navy pay for my medical school education, so I owed them 4 years active duty. During my active duty boot camp for doctors, which is nothing like boot camp for the Marines, which I later took care of. They basically took the doctors and nurses, put us on the ship, set it on fire, and told us to put it out. And needless to say, the ship sank. So, so I'm glad you guys do what you do, and I'm glad kind of what I do. But after I finished the Navy up, went back to cardiology, 3 years general cardiology training, so 10 years of training after college to get to where I was at. And right around the end of kind of my third year of training, I took care of numerous heart attacks, and it's very exciting in the cath lab, quote, saving somebody's life, but really got to the point of saying, like, why do these keep happening and what can we do differently? Because it's not just about your blood pressure, your cholesterol, your blood sugar, if you smoke and if you're overweight. If those are the 5 things you could fix, there probably wouldn't be very many heart attacks. There's probably 300 to 400 things that can actually drive vascular disease, and that's kind of got me curious. What are the other tests that we can do to take a look at it at an earlier stage? So I know a lot of you do some of the testing over at the hospital up north, and you get comprehensive blood work panel, and then some of you, if you're over 40, they have you go and do a stress test. So I tell people stress tests are really good if you're having symptoms. If you have chest pain, shortness of breath, you're short of breath, or exercise intolerance, stress tests are good at trying to recreate your symptoms. But by the time you fail a stress test, you generally have a 70% blockage in one of your 3 major coronary arteries. So that's a really late finding. And the challenge is that you can pass a stress test and very likely have a false sense of security that, hey, everything's good, I passed my stress test. But you basically have these little time bombs sitting in your arteries that once these little plaques that are generally less than 50%, half the time when you have a heart attack, you have less than 50% blockage in one of your arteries. So you have no symptoms until that plaque ruptures. And it's somewhat like, the theory that, your artery is not necessarily like a sewer pipe just filling up full of sludge and now it's 100% blocked and that's the heart attack. It's that you have these wall injuries in the artery. Your body keeps trying to repair this damage. If you don't shut down the fire, the damage to the arteries, these plaques rupture and then a blood clot forms. The blood clot forms basically to seal it off. It's similar like if you got a cut, your body's gonna form a scab to prevent the bleeding, but that scab essentially blocks all the blood flow downstream. No oxygen, no nutrients get downstream. That's what causes the heart attack. So, so it's more about the health of the artery than it is exactly, can you pass a stress test or not? I usually give the analogy or the story about, Tim Russert. He was an NBC News anchor. He passed a stress test 2-3 months before he died of a fatal heart attack. The other guy that had a big issue was Bob Harper. Bob Harper, very fit, biggest loser, has an MI, working out, sudden cardiac arrest, has to get resuscitated, gets LED stent, survives, but he has an abnormal lipid profile, this thing called lipoprotein A. 20% of the population has it, puts you at increased risk of early heart disease. Not saying necessarily if you saw me, I could have prevented his heart attack, but I would have been able to tell him he was at much higher risk than just looking at him from the outside. Because when you look at somebody from the outside, you have no idea exactly what the health of their blood vessels are. And by the time somebody fails a stress test, you're really late into the game. So what I ended up doing is going down the kind of functional medicine, integrative medicine approach, where we're going to the root cause of what's putting that plaque in your artery in the first place. And some of the tests that I routinely do, other than blood work, are threefold. One, the test I recommend almost everybody over the age of 40 get, unless they've already had a heart attack, stent, bypass, is a test called the CT coronary calcium score, or calcium scan. It's about a $100 x-ray of your heart arteries, about the same amount of radiation as a mammogram, and tells you, is there calcium building up in the walls of your artery? If there's calcium building up in the walls of your artery, indicates that plaque is building up in your arteries. Higher calcium, higher risk. By the time your calcium score is over 400, you have about a 90% chance that one of your arteries has a severe blockage in it. Doesn't necessarily mean you're going to need a stent or bypass surgery, but you need to be much more aggressive with your lifestyle, potentially supplementations and medications to reduce the risk of having your first heart attack, first stroke. So the calcium score test takes about 10 minutes or less. There's no IV, there's no real special preparation for it. And you usually get the results same day or next day. I literally just did mine on Monday. I usually get them every few years. Still a 0. This is the only test in the world you want to be a 0 at. If your score is 0, your risk of a heart attack is 0.4% over the next 5 years. So I know some departments are contemplating maybe they should get these calcium score tests. It'd be great if your departments would pay for it, but if they don't pay for it, it's $100. It's probably the best peace of mind you'd have. Are you truly low risk of a heart attack, or you're higher risk? If your score is 0, keep doing what you're doing. Work with your primary care doctor and such. We'll talk about all the healthy eating, healthy exercise, coming up. But if your score is basically over 400, you probably need to see somebody like myself or somebody who can really kind of get into the root cause of why are you putting plaque in your arteries. So test, $100, multiple places around St. Louis that offer it, and offline I can tell you where to go if you're interested in that type of screening test. Second test I typically recommend for patients is called the carotid intimomedial thickness scan, or CIMT. It's an ultrasound of the neck artery. The traditional Doppler ultrasound of the neck artery is looking for more severe plaque. Those basically measure, do you have a 50% blockage, 50 to 70% blockage, or greater than 70% blockage? We don't want to find disease that late. We want to look at it much earlier. So this test basically measures the thickness of your artery wall. You're supposed to have a certain thickness as you age. This test basically gives you a vascular age. So if you're 45 years old and your arteries are 65 years old, you probably want to do something about that. So frequently we'll find patients older than their biologic age. They get on the regimen of what I'm going to talk about. You repeat the study in a year. If everything's going according to plan, you'll see that thickness of the artery improving. So likely the plaque is improving in your arteries. If you had plaque in your heart arteries, that plaque is regressing. Plaque in your arteries is not necessarily going to keep progressing. If you do the right things, you can usually arrest it. And if you can do things more optimally, the plaque actually will start regressing, getting smaller. But the key isn't necessarily to get back to 0. It's basically get it to a point where it's stable and it's not likely to rupture. Plaque can be stable or unstable, and that's kind of the million-dollar question. Which quality of plaque do people have? Plaque is extremely common. 6 out of 10 people go get into the calcium score test, they're going to have an abnormal calcium scan, but many of them will never have a heart attack. So the question is, well, who's likely to have the heart attack? It's the people who have a lot of inflammation. Inflammation is your immune system turned on and staying on. You want your immune system turned on if you have an infection or if you injure yourself. But if your immune system's always turned on, the blood vessels are somewhat like the innocent bystanders. They're getting damaged as they're carrying all these substances through the bloodstream. So basically your arteries are on fire continuously, you're going to have a problem. So the third test I typically recommend that will tell you how healthy are those arteries right now is a test called an endopad. And as far as I know, I'm still the only person in St. Louis offering this type of test. It's not necessarily a pitch for you to go do it, but it's an interesting test if you truly want to know how healthy your arteries are. Because your arteries are only as healthy as basically how much nitric oxide they can release. Nitric oxide is a gas that dilates your blood vessels. So you have issues with your blood pressure, you have hypertension, you by definition are going to have some endothelial dysfunction. The endothelium is the inner lining of your blood vessels. I tell patients it's sort of like the air traffic controller deciding what's in the lumen of the blood vessel and what can get into the wall of the blood vessel. Somewhat also like a tennis net. So certain things are supposed to go through it, certain things are not supposed to go through it. If your endothelium is leaky, more stuff gets stuck below the walls of the artery, and you tend to build up more and more plaque. So the endopad test is a non-invasive test, takes 15 minutes, basically tells you how much blood vessels will dilate by how much nitric oxide they dilate. That nitric oxide also somewhat acts like Teflon, prevents stuff from sticking to the arteries in the first place. So again, this is something that looking at somebody on the outside, they can be very fit, but if they don't do the right things in the rest of their life, maybe they have sleep apnea, maybe they have horrible sleep, their body isn't repairing itself well, they won't have very good nitric oxide levels, and they'll fail this endopat test. So they may not necessarily have plaque in their arteries right now, but if they don't repair this endothelial dysfunction, the data shows that 6-7 years down the road, they will start laying down plaque in their arteries. So if you take the combination of these 3 tests and they're very low risk, chances you have a heart attack are almost zero in my hands, and anybody who can really do this root cause medicine. So for people who've already actually had stents, bypass surgery, then the calcium score test not going to add more data. The CIMT will give you a current vascular age and will tell you is the level of your pharmaceuticals, nutraceuticals, or supplements if you're on them, and your lifestyle, are you doing enough to prevent your second event? And then the endothelial dysfunction test, the endopat, will tell you, again, how healthy the arteries are right now. Because just because you've had a stent before, if your endothelium can release nitric oxide, you're much less likely to need a second stent or further procedure. So those are the 3 procedures or tests I usually recommend to people who are really wanting to know what is the risk of a heart attack or stroke. Blood work, yes, I do comprehensive blood work panels. You probably had your traditional cholesterol, your blood sugar, and maybe even your thyroid or your hormones checked. But I do a comprehensive plan that looks at 5 or 6 different inflammatory markers, sees if your arteries are on fire in the first place. Look at particles, look and seeing if your body has the certain things that carry cholesterol that are high. So particles are like cars essentially. Cholesterol is this waxy substance. It won't float in the blood by itself. So it goes inside the particles drive it to where it needs. Your body then uses that cholesterol to make your testosterone, to make the outer shells of your cells, make bile acids to digest your fat. So cholesterol is not inherently bad for you. Mother Nature did not put cholesterol in you to give you a heart attack. But if the cholesterol is getting damaged because of something in your environment, the damaged cholesterol gets trapped in your arteries, you start building up more plaque. So go looking for what's damaging cholesterol and shut off that faucet if you can. So the other thing I will typically do in the blood work, at least the first time people see me, is check lipoprotein A. It's a genetically inherited particle. 20% of people have it. Puts you at a 2 to 3 times increased risk of a heart attack if you have it and you have inflammation. And then, not in everybody, but in the right population, I will check, male testosterone levels and such, and see, because testosterone and your hormones are basically a signal of what's going on in your environment. If your hormones are really mismatched and out of balance, something in your environment is broken. Maybe it's your sleep, maybe it's you're completely sedentary, or you eat a horrific standard American diet. You can generally see it in your hormone panel. I failed to mention in the kind of the endothelial dysfunction part, I won't make anybody raise hands or anything like that, but erectile dysfunction is essentially endothelial dysfunction of your private part. So if your junk is not working, that can be the first sign that you have vascular disease. So sometimes this is kind of a chicken and egg thing, that some people will go see the urologist because they have erectile dysfunction. They're told there's nothing hormonally wrong. It's probably vasogenic. It means it's your arteries. They tell you go get your heart checked out. Person has a high calcium score. You start treating for that. You prevent their heart attack. Yes, they still have their erectile dysfunction issues, but you can work on that. So sometimes it's the kind of the thing that gets the person in the door to see a cardiologist. Other things, some people come to me for a cardiac complaint and then just, oh, by the way, doctor, I have erectile dysfunction. I tell them, well, that's a risk factor for vascular disease. Maybe do an endothelial function test. Can you make nitric oxide? You make nitric oxide, maybe it's not so much the blood vessels, and we'll go down the pathway of looking at hormones. And yes, I'm still going to have you go see a hormone specialist doctor or a urologist, but those are 2 of the things that are really kind of stuff that most 40-year-old men are not necessarily going to talk about with their doctor. But if you have that issue, you may want to bring that up, because that's kind of the red flag that there might be something going on in your heart. So we'll transition a little bit to what are the things you can do to reduce your risk of having the heart attack or stroke that don't necessarily require you to take pills. So I usually call it kind of the 4 pillars. And if one of the pillars isn't steady, the system tends to break. So it's how you fuel the body, how you move the body, how you deal with stress, and how well you sleep. And we'll deal with sleep last because it's probably the most important of it, and it's probably the number 1 reason why most firefighters have heart disease 10 years earlier than the average population. So how you fuel the body, nutrition. So I'm not going to tell you nutrition is not important, but it's not nearly as important as how well you recover and what else you're doing in your life. Food is information to your system. It basically tells you what's going on in the environment. All the food, for the most part, is grown by the sun. The sun grows the food, you eat it, or you eat the animal that grew the food. So your body's digesting information from the environment. So if there was a perfect diet for everybody, one of the diet doctors would have figured it out, and there's like 300 to 400 different diet books that come out every year. We'd all be doing the same diet. But there's not the perfect diet for every single person. It's individualized, depends on what your health goals are, but also depends on what your mitochondrial haplotypes are. So biology lesson 101, your mitochondria are the little organelles in your cells that make energy for you. They're like the little carburetors, essentially. They're the things that break down your foodstuffs, make them into electrons through the system, and pump out energy. So the healthier your engine is, essentially it won't matter as much the food stuff's going in as long as the engines are healthy. But you get your mitochondria from your mom. She gets it from her mom. Essentially everybody's mitochondria initially came out of Africa. We were all equatorial, and then eventually some people moved out of Africa, went north. People who went north, their mitochondria are less efficient. They're less efficient at burning fuel because they basically had to release heat to keep the people warm. It's the simplest way to think about it. So you wasted energy as you were burning food if you were Northern European. So this is what I tell patients is that the foods that you eat should ideally coincide with the seasons that you're exposed to. So if you're in St. Louis and there's 4 seasons, then summer, spring, when the vegetables and fruits are plentiful, that's when you're eating more carbohydrates. Fall, winter, not as plentiful in the carbohydrates. This is when you're probably more ketotic. So I usually get questions at the end about the keto diet. Keto can work, but it's not supposed to be something you do 24/7 for the rest of your life. It would have been evolutionary, something you would have naturally done because food wouldn't have been plentiful in the winter, and you would have had to learn how to burn your own body fat for energy and for heat. So keto can work, but it's not a panacea for everybody. The other thing I tend to recommend for patients is time restriction. So it's a somewhat a form of intermittent fasting. The best book on this subject is Dr. Panda's book. It's called The Circadian Code. The gist of it is if you can eat in a 12-hour window or less, there's great metabolic benefits. There's also great sleep benefits. So water 24 hours a day is fine. It's not going to mess with your cycles. But you have a circadian rhythm. Your circadian rhythm is your 24-hour cycle. It's programmed by light, and it's programmed by timing that food comes in. We'll talk more about the light stuff in the sleep part. But the timing that the food comes in, or anything that isn't water, so potentially even black coffee or tea, might set off this liver and gut clock. You have these gene clocks in the liver and gut in every organ. They basically turn on when they see stuff come into the system. They'll start making different hormones and proteins based off that information that's coming into the system. Your body needs 3 to 4 hours of nothing coming in, no more deliveries, before they flip the switch, say, okay, nothing else is coming in. Now we can take all that great nutrients and everything you put in the body, package it up, and repair any damage that's been done for the day or make your hormones. So this is the key, is that, whatever time your normal bedtime is, if you're a sick person, you need to be more strict. If you're not that sick, you can get away with this every once in a while, but try to not eat within 3 hours or 4 hours of when your natural bedtime would normally be. That gives your liver and gut time to shut off those clocks, and you go better into fat burning mode. So if you're trying to lose weight, improve your blood sugar, or improve your sleep, one of the hacks is basically stop eating early. You're going to end up being like an old person, finishing eating at 5:36, but your sleep's going to be better, or something will improve in your quality of life, and you'll be like, fine, I'm going to shift the time of day that I eat because I see the benefits. The other thing is about protein. Protein is very important for your muscle protein synthesis. So for those who know my brother Jeff, a couple months ago, he ended up in the ICU at Mercy with viral meningitis. He was sick on the vent for about 4 or 5 days. Just pretty muscular. He lost 12 pounds of muscle through that adventure, and he's back to full duty, full recovery. But if he didn't have as much muscle mass going into that, he wouldn't have recovered as fast as he did. Your muscle is your metabolic currency. It's your metabolic bank, so that when you're sick, you basically break down that muscle, turn it into things that your body needs to recover. So for any of you who've walked through an ICU and seen a little scrawny old man or old woman on the vent, the chances those people make it out of the unit are generally slim, or if they do, they're going to have a very prolonged recovery. So maintaining your muscle mass as you age is key to longevity. One of the ways to do that is your timing of your protein. Barest minimum is you want to try to get 90 grams of protein a day into your system, generally divided it up 3 times. You can get more than that, and if you have specific goals that you want to make more muscle mass, you're going to need more protein. That barest minimum, 90 grams a day. So we'll transition into kind of the exercise of the physical activity. So again, physical activity is important, but if you don't deal with your sleep, your recovery, you can damage yourself because exercise is a stressor. So some of my older patients say, well, I walk for exercise. Walking is activity. If you walk fast enough, you get short in breath. Okay, maybe it's exercise, but exercise is a stress to the body. You overstress it, the body has to get stronger so that it can recover from that stress. So exercise, if you're gonna only do one thing, I'm typically recommending patients do some type of resistance or strength training, because again, it's that muscle mass determines how well you live, how well you age. So, I'm not an exercise physiologist, so work with your local trainer, or if you know what you're doing, do the resistance training 2 to 3 times a week. If you have more time, then that's when you start considering doing the cardio stuff. So if you can do cardio, if you're relatively healthy, probably more likely to get benefit if you're doing interval type training or HIIT training. So HIIT training is just pushing yourself fast for 10, 30 seconds and slowing back down until your heart rate recovers, fast, slow. Maybe you're working out for 7 to 15 minutes doing some type of cardio. That's all your body really needs for optimal oxygen delivery to your cells. Anything longer than that is for, not necessarily just for show, but it may be a skill you're trying to develop. So typically we tell people that they want to run a marathon, that's a skill you're developing, but it's not necessarily the most heart healthy thing for yourself to do long term, because you're stressing the body, you're damaging it. If you don't give the body time to recover and repair, you'll just keep stacking damage on itself. And this is basically the story of why a lot of these long distance runners and ultramarathoners end up having vascular disease. They come in my door, other people's door, and they say, like, I've run for 30 years, there's no way I can have heart disease. I'm like, you have very advanced heart disease because you were very inflamed and you didn't let your body recover. So some metrics you can measure for recovery are your heart rate variability. Heart rate variability is the beat-to-beat difference of your heart rhythm. So for the people who are medically inclined or medics, on an EKG, it's the R-to-R interval. When you're at rest, your heart rate should not necessarily be 70, 70, 70, 70, 70. As you breathe in, your heart rate expands, you breathe out, contracts. That delta, or how much it spreads out, is your heart rate variability. The better that heart rate variability, the healthier your heart is. The tighter it is, the more stressed your system is under, and also likely the more overtrained you may be. So there's different monitors, there's chest straps, there's watches that'll measure this heart rate variability. For the most part, you do it first thing in the morning for 1 to 5 minutes. You get a measurement, do it for a few days, get a baseline. And if your heart rate variability is not good that day, probably a day you shouldn't go balls to the wall, exercise. Your body's in this overstressed situation, so a more light day. If your heart rate variability is good, push it then. So it's just a quick metric to that, how much stress is your system under. And I usually talk about Tiger Woods, Roger Federer, both #1 players in their respective sports. Roger Federer rarely broke down because he really prioritized recovery. Woods had obviously marital issues and also had some major sleep issues. He'd wake up in the middle of the night, couldn't sleep. He'd go out and run a 5K. He'd lift weights at 2 o'clock in the morning. He basically broke his circadian rhythm, and Woods ended up having multiple back issues and had major spine surgery before the age of 40. Now I know he's back playing again, but there's multiple months and years off of his prime time of playing, where Federer never really broke down for long periods of time. Then we'll transition to kind of the third pillar. It's your stress. Everybody has stress in their life, and obviously, your guys' day jobs is a stressful situation. You have an autonomic nervous system that has 2 wings, essentially. It has your sympathetic tone and your parasympathetic tone. Your sympathetic tone is your fight or flight response. Parasympathetic is your rest and relaxation. So, you're laying in bed, tones go off. You go from 0 to 100. That's normal, But how fast can you get back down to a normal range? That is key. And what else is triggering you? Tones go up. Yes, you need your cortisol to go up. That provides sugar to your muscles to run and go do what you need to do. You need adrenaline, raise your blood pressure, pump blood to your brain, your muscles, make your eyes work appropriately. That's what your body is meant to do during that fight or flight response. But you're not supposed to be stuck in that 100% of the time. That basically is burning the candle at both ends if you always have these hormones and stuff at high levels. So how fast can you get back down to normal? So there's many things that can be done that help with stress relief, and I'm not an expert in any of them, but meditation is always a good thing, but meditation can be hard for beginners because how do you know it's working? The goal isn't to have your mind blank and you're some kind of Zen Buddhist expert. It's just mostly that your mind's going to think about something else, and how do you bring it back to the middle? How do you bring it back to the middle? And breathing during meditation is basically training that nervous system to get more in balance. So there's different apps you can use on your phone. There's Headspace, Calm, 10% Happier. There's a bunch of free ones. or at least, free then paid ones that can at least teach you the basics of meditation. Deep breathing exercises, so teach patients the box breath. You always have your breath with you, so breathe in for 5 seconds, hold 5 seconds, out for 5 seconds, hold 5 seconds. Takes 20 seconds to do a cycle. Try to do 5 cycles. That deep breathing stimulates your vagus nerve. That stimulates the parasympathetic tone, brings it back up. That kind of brings down that fight or flight response. Then there's exercise. A lot of guys, they want to go, pound a bunch of weights, help burn off stress. Yeah, that's one thing you can do. Yoga helps with it. Again, a lot of it's the breathing component of yoga that helps with it. And then for people who are more wanting a tech or instant biofeedback, the device I typically recommend is called HeartMath. It's about $100 or so. Plugs into your phone. Looks like a pulse ox. Clips to your ear. Measures your heart rate. It's also somewhat measuring that heart rate variability we just talked about, but it gives you a biofeedback sensor with your breath. So if you're breathing according to getting your brain and heart to be more coherent and bringing that parasympathetic and sympathetic tone back in balance, you'll see the colors change from red to green. And if your body's under a lot of stress, you'll see it's in red. So you'll know if you're breathing right or doing it right. So sometimes this is more useful to kind of give you that instant feedback. Is this working? Then after you've done it enough, you kind of know how to do the breathing right. You don't necessarily need the device. You can go by and do it. But there's significant data that if you just do this HeartMath for like 5 minutes a day, should help you with your stress relief for sure, but may help you sleep, may help your blood pressure, help your anxiety. So a lot of my patients, come to me for either symptoms of acute or chronic stress, get their stress levels down, and that tends to help their sleep, which we'll transition into next. So the fourth pillar, and I think probably maybe the most important pillar, is how will you sleep? And just by show of hands, how many people here have issues with their sleep quality or their duration? It's usually about half. So you either have an issue of falling asleep, staying asleep, or both. You just start with that, yes, there can be a medical reason why you don't sleep well. If you have sleep apnea, you need to get assessed for that and treat it if it's there. Sleep apnea is, basically extremely common and is extremely commonly not necessarily misdiagnosed, it's just underdiagnosed. But apnea happens when you stop breathing while you sleep. The more times that happens, the more stress you're putting on the body. So, if you're waking up in the morning and feel like you didn't sleep well, you're tired throughout the day, you have headaches, or you already have basically end-stage heart issues, you have coronary disease, high blood pressure, atrial fibrillation. Those are sometimes signs that maybe there's something wrong with your sleep. You fix your sleep and you may stabilize those heart conditions. But during apnea spells, when you stop breathing, your body becomes hypoxic. You don't have oxygen to basically run through the mitochondria to make energy. You're also putting tremendous stress on the heart when your airway is closed off. The heart chambers aren't necessarily collapsing, but they're basically trying to force back so that they don't collapse. And then when your airway opens up, it releases that stress. So that's causing tremendous rises in your cortisol, your adrenaline levels. That will raise your blood pressure. Cortisol makes your blood more sticky, more likely to clot. So if you have apnea, there's other ways you can treat it. There's CPAP mask. If it's more mild, you can get a mandibular device made by your dentist. Basically a mouth guard that just juts your jaw open a little bit and keeps the airway from collapsing. There are in-lab sleep studies, so if you have something other than sleep apnea, you got restless legs, you got narcolepsy, you got some other sleep disorder, that's going to take a full-on sleep study in a sleep lab. But if it's just more concerned that, hey, I snore, somebody said I stopped breathing, there are devices, and we have it in our office that are home sleep studies that basically look like a watch, measures your pulse ox and some other things from your finger, and will tell you essentially that next morning, hey, I got mild, moderate, or severe sleep apnea. So if you have apnea, get screened. But then if you don't have a medical issue and you still can't sleep, many times it's back to that circadian rhythm issue, that 24-hour cycle. So we talked about earlier, nutrition is one of the triggers for that circadian cycle, but the other big one is the light cycle. So humans evolved outside. You would have been outside 80-90% of the time up until about 200 years ago, less than 200 years ago. It's actually 1879 when they invented the light bulb. Once the light bulb's invented, people tended to stay up longer and they stayed indoors more. So now most people are stuck indoors 80-90% of the time. Your light programs your hormones. Your light programs different chemicals in your body. And we're programmed differently by this artificial light you sit under and the screens you're exposed to than you are by sunlight. So the sunlight is what actually programs your hormones in the morning. So if you have low testosterone, one of the things you should be doing is seeing the morning sunlight, because that's what turns on the signal in your brain to make testosterone. The other big thing is that if you don't sleep well, it may be because your melatonin levels are very low. Melatonin people think is something that just helps them sleep. Melatonin is the hormone that makes the mitochondria, those engine things, basically recycle themselves at night. The damage that's done through the day, melatonin's used somewhat as the fuel to make those mitochondria that are bad get recycled, or if they're really bad, kicked out. But melatonin cannot be a pill. You cannot pop melatonin pills and make the system work appropriately. There's risk of taking oral melatonin for long term that may mess up the retina part of your eye and can increase retinal bleeding. So if you have low melatonin levels, it basically means there's something wrong with your light environment for the most part. And so seeing morning light, morning sunlight helps reprogram this clock in your brain. Going outside during the day, the sun's basically a GPS clock setting your signals in your body to make hormones effectively. And then once the sun sets, up until the light bulbs were invented, unless you had candles or campfire, you didn't see a lot of intense light at night. Those light sources were mostly red or warmer. They weren't bright, cool, white, blue light. This white, blue, cool light that we now have is very energy efficient, but this light basically tells your brain it's noontime, it's July, stay awake. You make hormones differently when you have a lot of bright light than you do when there's dark light. So I tell my patients, get outside, see the sunrise, because that resets the circadian clocks quickest. Try to keep going outside for a few minutes a day. It's almost like your smoke break. Go out there for 2-3 minutes, without anything between your eyes and the sun. Just let the sun hit your eyes. You don't have to stare at the sun, just face that direction. And then at nighttime, once the sun sets, to the best of your ability, minimize your overhead lights, minimize your screen exposure. But if you're going to be exposed to a lot of this stuff, then you want to get pairs of these type of glasses. So these glasses filter out different wavelengths of light. These are the daytime ones that I wear. They don't filter out all the blue light, because you still need to get some blue light in your system to make cortisol appropriately. But this cuts down on the glare from computers. It helps with eye fatigue, likely to decrease migraines if you suffer from migraines. And basically you can work longer on a computer without significant eye fatigue. But in the evening time, once it's supposed to be dark, you want to let the body start making melatonin effectively, as you probably would want to upgrade and get a pair of darker glasses. These glasses block all blue light and up to the point of green light. That can be stimulating to the system, so you'll keep very high levels of melatonin. Your body needs darkness to release that melatonin. If you keep being exposed to blue light till 9:30 at night and try to go to bed at 10, you essentially depleted melatonin. You won't have enough to basically keep you asleep all night. So the first hack is just try to control your light environments and see if your sleep improves. Some other sleep things, yes, it's not necessarily going to be applicable to when you're at the firehouse, but at home, your bedroom should be a sleep sanctuary. It should be a place where your body's going to recover. So only two things that should happen in your bedroom are sleeping and sex. You should not have a TV in your bedroom, because one is the light, and also conditions your body to, hey, I should be doing something else in bed other than recovering. So if you have issues with sleep, you want to know that when you go into the bedroom, your body's prepared to go do that. So you have a routine. For those of you who have kids, you're not going to take your kids from running around in the living room, pick them up and throw them in bed and expect them to go to sleep. They have kind of a wind down routine. You should have somewhat similar type of routine for yourself. Whatever that is, you stop using your tech half hour before your bed, read a book, talk to your spouse, do whatever you want to do that doesn't involve you to be all stimulated, so your mind and body is getting ready to go to sleep. Your bedroom should be as dark as possible. It should, be basically a cave. You can get blackout curtains if you got light coming in from the street, and you shouldn't have, phones or, clocks or something like that are putting out a bunch of light at night. And especially your phone. Your phone really should not be ideally used as your alarm clock unless you're willing to put it in airplane mode or put it way across the room, because your phone emits different electromagnetic frequencies, radio waves and such. Those radio waves, it's a little bit more complicated than this, but they're basically radio jammers to your mitochondria. Your body's trying to repair itself at night, and if it's getting different signals that interfere with that repair process may not happen. So if you have nightmares or just have really weird sleep at times, take your phone and make sure it's not by your head when you're sleeping. put it 12 feet across the room because the radiation decreases the further it is away from you. Or ideally, keep your phone out of the bedroom. The other thing is cool. The cooler your room is generally a signal to the body it's time to sleep. So if you can, have a fan, open the window, something that keeps the room 68 degrees or cooler, you'll tend to have better sleep quality. So those are kind of the biohacks and tips for nutrition, exercise, stress, and sleep. And I thank you guys for your attention for listening today. It is my goal to get out there and help the fire service and, get back to let them know that there are things you can do that really can reduce your risk of having a heart attack and stroke. And that, if you're interested in working with somebody like myself, I obviously have cards available and answer any questions. But if you're interested in anything that I talked about, I'm on social media. I'm on, Instagram. Dr. Twyman is my Instagram handle. I have a lot of kind of the biohacks and some of the tips lately about the calcium score, the CIMT on my Instagram, and have a YouTube channel where I kind of put these longer form videos. So I will put this video up on my YouTube channel later. So for people who want to rewatch it or missed it because they ran out on calls, which happens every time usually I'm at one of these kind of talks, I'll have it up on YouTube pretty soon. But my main website is Apollo Cardiology. My office is in Clayton. And if you're interested in working with me, come talk to me. Or if you have family and friends that are interested in working with me, I'd be happy to have any type of referrals from you guys. So again, thank you for your attention, and I'll open up to questions now. Yes, sir.
Can you hit on the sunscreen?
So, the quick and dirty is there's no real reason to use sunscreen unless you're absolutely stuck in the sun and cannot get out of it. Use physical blockers instead. Hats, clothes, shade. Basically look at what your animals are doing. If your dog's running inside because it's too hot, you probably should be inside at that time too. So sunscreen, the biggest concern about it is some of them have a lot of hormone disruptors in them. Your skin absorbs everything you put on it. So if you're not willing to drink or eat what you put on your skin, you shouldn't be putting sunscreen on your skin that has that stuff. Your body makes vitamin D from sunlight, UVB radiation. Typically it's midday or so radiation. There's a free app called D-Minder. I recommend almost everybody download this thing. It tells you what time of day that UVB radiation comes out. So you need vitamin D for multiple processes in your system. But vitamin D is a good marker for basically your sun exposure. The higher vitamin D, the less mortality you have. You cannot necessarily take oral vitamin D and make the same biochemical reactions happen in your system. You still need the sunlight to program it. So, I typically will talk about some of my own experiences with this, is that, it's more about hybrid tanning. So preconditioning your skin for when that high radiation comes out, that UV radiation midday. So if you're very pale, you're a Fitzpatrick type 1, you will burn if you're outside more than 10, 15 minutes. But you need to kind of use the sun as it was intended. You grew up outside up until 200 years ago when the light bulbs were invented. So you would have normally been up for sunrise. At sunrise, there's red light, blue light, green light. That light on your skin preconditions it for when UV light's coming out later in the day. So the more red light you get in the morning time, the less you're likely to burn in the afternoon time. So this is sometimes the challenge that people in St. Louis, there's no UV radiation for about 2 months out of the year, about late November